Oh, hello there! Hi everybody! Hello to all the nurses out there. This is nurseniezl and welcome back to my channel. This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organizations' websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the Osce examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice. Suppositories. Here, suppository is a solid or a semi-solid bullet-shaped pellet. This is a mix of medication and a wax-like substance that melts following insertion into the rectum. Suppositories are used for local or systemic effects to empty the bowel prior to surgery, investigations, or examinations. It can also be for administering medications. It is also used to soothe or treat the hemorrhoids or anal pruritus. Suppositories can also be considered when oral medications can be used in the palliative care. If the patient has swallowing difficulties or has severe nausea and cannot retain or cannot take any oral medication. And yes, today I'm going to show you how to do an administration of suppository as part of your Osce skill. You have 10 minutes to finish this station. As I always say, whilst giving medication or when giving medication, you have to remember your 5 R's. And those are right patient, right medication, right dose, right route, and the right time. Nurses, make sure to check the ID of the patient and of course the allergies and allergic reaction. Make sure that you have an accurate documentation. Not doing the said marking criteria will result into a fail, and we don't want that, do we? So, are you ready to do this procedure? Yes? Okay then, please do hit the like button and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell right over there. Comment down below what other Osce videos you want me to do next. Are you ready? Let's go! So the first thing I'm going to do is to wash my hands using the steps of hand washing in accordance to the World Health Organization. First, I'm gonna wet my hands. Get some soap with 5 backward and forward stroke from palm to palm. Right palm over the left dorsum and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb. Rotational rubbing of the finger clasp. Vice versa. And rotational rubbing of the wrist. Rinse it thoroughly with water. Then pat it dry with clean towels. And dispose it accordingly into the domestic bin. And that's how you wash your hands using the steps of hand washing according to the World Health Organization. Miss Examiner, is this trolley clean and ready to use?
Yes, it's clean and ready to use.
So, if it is already clean with soap and water for the past 24 hours, as the examiner confirmed, we don't need to clean it. But if it's not clean, then wear your gloves and apron, clean it with clean nail wipes from the farthest to the nearest with single stroke in a zigzag motion, and then discard it into the clinical waste bin, including your gloves and apron. Let it dry for 30 seconds. So now, I'm gonna prepare all the articles that we needed. Before I do that, by the way, I need to read first the prescription. I'm gonna put it in the screen right over there. Okay, so according to this scenario, you are visiting Richard, a new patient at home who requires administration of glycerol suppository. All the equipment you need is provided. Please administer the medication using the prescription below. Again, the prescription says the name, Mr. Richard Cash. Address is ABC 123 Edinburgh Avenue, NR 317HA. Date of birth is 28th of the 6th, 1977. The drug name is glycerol suppository. Dose, route, and frequency, we got 4 milligrams suppository once a day. Okay, the prescriber's signature is there. The prescriber's name is Dr. Jean Gray. Name and signature of the doctor and the date. Dr. Jean Grace is there and the date is today. The patient is allergic to warfarin and the reaction is rashes. So I'm gonna prepare now the articles. Right, Miss Examiner, is this a disposable tray that we're gonna use today?
Yeah, this is disposable.
Okay, so I have got here the glycerol suppository, 4 grams, rectal use. Okay, expiration date is 1st of the 2nd, 2026. Compare the medication against the prescription. So I'm gonna put it here on the tray. I have got here the lubricating jelly. Expiration date is 6/20/27, clean and intact. Here goes square. So again, clean and intact. Expiration date is 11/20/26. So I'm gonna put it here. Okay, Inco sheets. All right, nurses, make sure that you mention any of the following. It's either the bedpan or a commode, depending on which is available in your exam center, okay, on the day of your exam. So let me get some gloves, get some apron, wear the apron, gel hands, and let it dry for 30 seconds. Now I'm going to take the trolley near the patient side. Gel my hands. Let it dry for 30 seconds. Make sure that the scene is safe. Hello there.
Hi.
Hi, I'm nurseniezl and I will be your nurse for today.
Oh, hi, nurseniezl.
Hello there. I am here actually to give you your suppository, if that's all right with you.
Yeah.
Okay, because according to your prescription, you need to have them at the moment, if that's all right.
Yeah, all right.
Okay, so before we even start, I just need to confirm. Can you tell me your name first?
Richard Cash,
Can you give me your date of birth?
28 June 1977.
And your address, please?
ABC 123 Edinburgh Avenue,
Okay, and your postcode?
NR 317HA.
Okay, so I can see that you are allergic to something. Are you allergic to any food, medication, or latex?
Yes, I'm allergic to warfarin.
What kind of allergic reaction you
I got
from that?
rashes.
Rashes, okay? Don't worry, I'm not gonna give you any warfarin-containing medication, okay?
All right, thank you.
Okay, are you happy for me to proceed?
Oh, yes. Yeah.
Make sure that you provide privacy and dignity of the patient. Close the windows, the door, or the curtain, okay? Are you comfortable? Do you have any pain at all?
I'm actually having stomach ache as I haven't opened my bowels for 6 days now.
6 days.
Yeah, 6 days.
Can you rate the pain from 0 to 10? 0 being no pain and 10 being the worst.
Around 5.
5 out of 10?
Yeah.
Did you had some pain relief already?
Yeah, I had pain relief 30 minutes ago.
30 minutes ago. Do you still want more or do you want to wait for that to take effect?
Yeah. Let's just wait for its effect.
Okay. However, do you want me to still give you the suppository? It
Oh,
will
yeah.
help you relieve your bowels.
Oh, yes, please.
Okay. So, would it be okay if we position you to the right position? I'm gonna need you to lay down on your left lateral side, if that's all right.
Oh, okay.
Okay. Let me just wear my gloves so I can help you reposition, okay?
All right.
Alright, now I'm gonna help you to reposition yourself. I'm gonna need you to lay on your left lateral side with your knees flexed and your feet slightly level or raised and your buttocks near to the edge of the bed. Okay, since the patient, I only have a half mannequin at the moment, so I will show you here on the screen how the patient should lay on their left lateral side, like this. So, we're gonna start the procedure now. Okay, now I need to expose your bottom, if that's alright with you.
Oh, yeah.
Okay, so expose the patient minimally. So before we even start, make sure that you have your bedpan or commode. Okay, Richard, would you want to have with you a bedpan or a commode near the bedside?
No, I'm okay. I could just run to the toilet.
Okay then. So if you need any help with that one, just give me a shout, okay? I'll be here for the next 15 minutes anyway, okay?
Alright.
Alright. So in the meantime, would it be okay if I now proceed with the procedure?
Oh, yeah.
The first thing I'm going to do is to put the Inco sheet underneath you, if that's alright.
Okay.
Prior to inserting the suppository, what I'm going to do is to observe the anal area, which is, as you can see, the anal area is clean. There is no skin soreness, there's no excoriation, there's no swelling, and there's no hemorrhoids. Also, I can see no rectal prolapse or infestation. Nurses, all the things that I've said a while ago, all those signs, you have to mention all of those, okay? Don't forget. So what I'm going to do is to get a gauze, get a lubricating jelly, there you go. Now I'm gonna open the suppository. Get the gauze, lubricate the suppository, and now I'm ready to insert it in the rectal area. Okay, Richard, I'm about to give it now, if that's all right with you.
Yeah.
So what I'm going to do is to separate the patient's buttock and insert the suppository using the correct end and advancing it approximately 2 centimeters to 4 centimeters. So again, this is the right end, okay? So I'm gonna give it now. You have to make sure to open it, yeah, before inserting it, okay? Here we go. Okay, now you have to advance it for 2 to 4 centimeters. And there you go. Repeat this procedure if additional suppositories are required, okay? What I'm gonna do is to get the remaining gauze and clean. Now we're gonna clean any excess of lubricating jelly from the patient's perineal and perianal areas using gauze squares after insertion of suppository. So again, there you go. Now it's clean. Now I'm gonna do is to dispose it immediately in the clinical waste bin. Remove the incontinence pad. Discard in the clinical waste bin. Okay, cover the patient. Make sure that the patient is decent. I'm just gonna dispose everything in that clinical waste bin, including the tray, the gloves, the apron. Okay, now I have to gel my hands and let it dry for 30 seconds. Now I'm gonna go back to the patient to do my patient education. Richard, I need you to be on your back, lying down for 20 minutes or until you're not able to do so, okay?
Alright.
Also, I just wanted to inform you that there may be some discharges on the rectal area, but don't worry, that's just the medication melting in the rectum. If you need be, I can assist you to your required position. Also, I can give you the bedpan or commode, yeah, or I can assist you to the toilet if you have to.
Alright, thank you.
Alright, I'm gonna be here for the next 15 minutes if just in case there is any adverse reaction with the medication. If not, if you have any question, call your GP or your district nurse. Also, if there's an emergency, call 999, okay?
Alright, thank you so much.
Okay, I'm just gonna document regarding the procedure, okay?
Alright, nurse.
Okay. So, signature. Now that I'm finished documenting, Richard, I'm gonna go now. Thank you so much for today.
Thank you, nurse.
Do you have any question?
No question at the moment.
Are you comfortable now?
Yes, I am.
Okay, please do inform us if you had opened your bowels already, okay?
Alright, thank you.
Thank you also. I have to gel my hands. Let it dry for 30 seconds, and then after the procedure, I will wash my hands using the steps of hand washing. Also, if I have used a trolley, I will verbalize that I need to wash it with soap and water after the procedure. And that's the end of suppository administration skill. I hope you learned something for today, and if you like this video, don't forget to hit the like button and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Comment down below what other Osce videos you want me to do. This has been nurseniezl. See you on the next one. Bye! Okay, so today I'm gonna give a shout out to David Mubanga. Congratulations! Shout out to you, David! I'm really glad that my channel helps you to pass your Osce exam. Thank you so much. And again, congratulations. I wish you all the best, alright? So for everybody who wants to join the shoutout section, please do comment down below and also click the membership or the notification bell. See you on the next one. Good night.